इंसानी जिस्म में होने वाले तमाम खतरनाक सरतानों में से छाती का सरतान भी एक है, जो हर रोज सारी दुनिया में लाखों खवातीन को मुतासिर कर रहा है और औरतों के शरअ अमवात में इजाफे का एक बहुत बड़ा सबब बनता जा रहा है। क्या आप जानते हैं, अगर छाती के सरतान की तशखीस उसके इब्तिदाई मराहिल में हो जाए तो 98% मरीजों का इलाज हो सकता है।
As you have just heard, the early diagnosis and treatment of breast cancer can cure the patients and thus decrease deaths due to breast cancer. According to World Health Organization, United Nations, and reported in the Journal of Pakistan Medical Association and the major news media, Pakistan has the highest incidences of breast cancer in Asia, in excess of 90,000 cases reported a year, of which 40,000 deaths are reported. We can stop this killer now. Simple action is required. 1. Early diagnosis. Starting at age 40, get regular mammography. 2. Immediate treatment, including precise surgery, partial mastectomy or a lumpectomy, and intraoperative radiation therapy. Welcome to Radiation on Demand. ROD is dedicated to bringing mobile technology to you, providing radiation at the time of surgery for breast cancer patients. This single dose of radiation during surgery, commonly known as IO-ERT or intraoperative electron radiation therapy, is performed in less than 2 minutes, treats the tumor bed, and replaces up to 35 radiation doses at an outpatient radiation center after surgery. This time-saving, life-saving treatment can now be delivered locally to your community, facility, and physician for the convenient and efficient treatment of breast cancer. This technology is fully approved by the FDA and all radiation therapy experts agencies and has been in use for more than 15 years for various types of cancers. Professionals are very confident about its usage and outcomes.
The standard treatment that we would use prior to having intraoperative radiation would be a woman would come in day 1 for a lumpectomy and a lymph node biopsy. That's usually an outpatient surgery, so she'd have her surgery, she would recover from her surgery, she'd heal her wounds for about a month, and then she would start 6 to 7 weeks of whole breast radiation.
What's entirely different now and what we're going to offer is that for some women, they'll have the capability of having that 7 weeks reduced down to 1 day. And that 1 day will be in the OR at the time of lumpectomy. Not only are we reducing the time, we're also reducing the treatments to normal tissue. And that treatment includes the skin, the chest wall, the muscles underneath, the lung, the heart, and anywhere else photons can travel while we're treating from the outside. And I think that's the key for women. Minimize their normal tissue injury and get them home as quickly as possible.
So we would do the lumpectomy surgery in a very traditional way. And once the cancer's been removed, we bring in the linear accelerator machine right into the operating room while the patient's asleep on the table. We bring the electron device right into the surgery and we deliver the radiation into the wound where the cancer was. That treatment takes 2 minutes and it's directing radiation treatment right at the lumpectomy site.
The main cosmetic benefit is that we're not going through the skin. So the radiation is delivered directly to the surgical cavity. That means no skin changes for women, no fibrosis or scarring, no hardening of the skin or the tissue underneath it, and the appearance is just as if you've had that lumpectomy with that small scar, and that's it.
The patients we're going to be using this new treatment on are women over the age of 60 with breast cancers less than 2 centimeters in size. We're aiming to use this in women that don't have any lymph node spread, and the cancer should be estrogen receptor positive.
For all the other women, less than 60, who may not have all the same good features, they can still receive a portion of their radiation in the operating room. So if you have at least a portion of it in the operating room, you're minimizing 2 to 3 weeks of that 7-week course that you'll need on the outside. So you'll only need about maybe 4 to 5 weeks of radiation. And they'll be spared that extra boost dose from the outside of the skin. So the cosmetic outcome will be better even for them.
This is really cutting edge technology, state of the art technology. There's very few centers in this country using this technology.
In support of the technology, there is enough evidence from worldwide research, trials, and multiple studies that concur that IOERT is the most viable treatment for early diagnosed localized breast cancer. All of these reports are available on our website, www.radiationondemand.com. World-renowned radiation therapy associations such as ASTRO and ESTRO and breast surgery organizations such as ASBS have participated in establishing treatment protocols. We at Radiation on Demand, or ROD, are focused on breast cancer patients as we feel that this has the best impact for efficient treatment and immediate return to normalcy in the life of active and progressive women. Today's more conscious women have regular mammograms done as a routine, thus are able to diagnose any breast cancer in early treatable stage. Radiation is part of the normal protocol, but IOERT is a single dose of radiation at the time of surgery, and it saves the patient of going through 5 to 7 weeks of daily radiation trips. Just the thought of a single dose replacing up to 35 doses makes for a better psychological and lifestyle outcome. Choosing treatment options for the cancer patient is always very challenging and difficult. However, being aware of all of the options available with the best efficiency, efficacy, and outcomes is the primary goal of all patients. We at ROD are dedicated in supporting your decisions and providing you with clear information and comparison studies that have been vetted out by the professionals on a worldwide basis. For further information and additional testimonies, please explore our website, www.radiationondemand.com. You are welcome to contact us for any information by emailing your questions to info@radiationondemand.com. Thank you for your attention, and we hope we have been helpful in making your challenges more manageable.